Now, let me connect some dots and relate it to the topic of this podcast. If all of your patients come to you, and I'm deliberately using an extreme, if all of your patients come to you because they find you on the insurance company website, where are you more likely to be on that spectrum? Where do you think, Darren? Transactional versus relation. If they come to you because they looked you up.
Yeah, transactional, Gary. I mean, I think this is what the insurance companies want. Like you correctly pointed out, they want you to be a provider. They wanted you to be an industry, and it's transactional, right? In industry, it's
You're just one of
transactional.
many. You're not unique. You're just all dentists are the same, right? Right.
Yeah, exactly.
Well, how do insurance companies foster the idea of all dentists being the same? Well, all the dentists on the network charge the same thing.
Yeah,
exactly. They charge the silly fee that they set for you.
Yeah, exactly.
You're all the same. So they are by virtue of their operations making you an industry.
Right.
Because they're setting your fee and they're assuming that a crown is a crown is a crown is a crown is a crown. And I think all of us listening to this know differently.
100%.
Know differently. Now,
100%.
if you get all of your patients, 100% of your patients by patient referral, where would you likely be in that spectrum?
It's going to be relational, right? It's going to be
relational because someone thought highly enough of how they were taking care of your practice to tell someone they cared about your practice. Exactly. Now, I would also suggest that another way to look at that is you can use Google as a way for you to craft a more relationship-driven practice, because now you can have people find you for particular reasons.
Right.
For particular reasons, as opposed to another grain in the sand on the beach. If it's an industry, you're all the same. But now maybe we want to be known as a practice that has a very high number of 5-star Google reviews.
Right.
And so now when people, where do a lot of people go today to research their purchasing decisions for anything? They go to Google.
Google, 100%.
They look at Google reviews. Google reviews has become a kind of we used to have consumers guides, that would give us reviews on different things, different products. Mm-hmm. And now we have Google reviews. So, if your patients come to you because they're seeking you out, maybe you're known as a very gentle dentist in terms of the way you take care of patients. Maybe you have a niche within this. Maybe you're a more holistically based practice. Maybe you're more cosmetic based practice. That would indicate that you're a little bit more on the relationship driven side of the practice. So I wanted to do this podcast episode today to open a debate with our listeners on, is dentistry a profession or is it an industry? I'm going to go on record as telling all of you that I believe that it is an industry. I believe it is a profession. I got twisted up reading the title.
I think insurance companies have too much of an influence on you too.
Yeah, it is a profession. I think the amazing work that you and your team members do to serve your patients, to serve your team, to serve your community, absolutely qualifies you as calling yourself part of a profession. And I believe that the words that we use are important. And I would like to politely suggest that together we all start referring to what we do as being part of a profession rather than being part of an industry. Some of you may think it's semantics, but I think it's a lot more than that. And do that exercise. Draw that horizontal line. Put transaction on one side, relationship driven on the other. Draw a line where you think you are. Draw a line where you'd like to be, and talk about what you need to do to get there. And if you'd like help with that, we are accepting new clients. One of my greatest joys is helping doctors successfully resign from PPO plans. If you'd like more help, with that, schedule a coaching strategy meeting with me. You can go to thrivingdentist.com/CSM. That'll be a Zoom meeting with me. It opens up my calendar. Pick a time that works for you. It'll be an hour meeting. Purpose of that meeting is for me to learn about you and your practice, and for you to learn about our coaching and determine if there might be a good fit to work together. There's enough time yet this year, at the time that we're recording this, Naren, there's enough time this year for any of our listeners to significantly reduce their insurance dependence before the end of the year, and possibly even go all the way to fee for service before the end of the year successfully. There's enough time to do that. Just go thrivingdentist.com/CSM. And if you like help with marketing, Naren and his team is at the ready to help you attract patients from some other way than finding you on the insurance company website. You can schedule a marketing strategy meeting with their team, with Equa. Naren, what URL do you like to use for that?
Yes, the URL I think I would like to use for that is equa.com/LID, ekwa.com/LID.
And that'll allow them to schedule a marketing strategy meeting with you, or with someone in your firm.
Absolutely.
Yeah. Well, as we wrap up this today, thank you for the privilege of your time. Hope I've given you something to think about today. And we look forward to connecting with you on the next Less Insurance Dependence podcast.